Pregnancy brings all kinds of new sensations. Which ones are just interesting and which ones are alarming? Hi, I'm Melissa Evans. I began as a childbirth educator in 2004, and I'm also a doula and a couple other things. I know it's really important for families to have quality childbirth classes, and that it's hard to fit into calendars and budgets. So I'm offering my classes here for free so you can watch them anytime, anywhere. Please know that I don't practice medicine. I am not a medical professional or a lawyer, so use common sense and talk things over with a professional that you trust, which is exactly what this class is all about. But for now, here are 15 concerns you should talk to your care provider about right away. Some of these are indications of infection, some of these are indications of pre-eclampsia, and others of preterm labor, all of which require the assistance of your trusted and professional care provider. Number 1 is excessive vomiting. Yes, I know morning sickness is a thing, as if it only works in the morning. Not funny, I know. I'm so sorry if you have to deal with this. As troublesome and irritating as that is, that nausea, unfortunately that falls into the realm of normality. However, if you are vomiting so much that you can't get nutrients in, that you can't stay hydrated, that's hyperemesis gravidarum, and that's a serious problem that needs some serious help for you and your baby. Number 2 is an infection, especially a fever. We don't want mom's core temperature to be raised. That can negatively impact baby. So if you find yourself fighting something off with a fever, make sure you talk to your care provider so that can be remedied sooner rather than later. Number 3 is pain during urination. Urinary tract infection is never fun at any point in life, but in pregnancy it's even a little bit more concerning because the bladder is right next to the uterus, so we really want to nip that in the bud right away. Call your care provider. Number 4 is a foul-smelling vaginal discharge. Yeah, pregnancy and birth and parenting is super glamorous, but again, those can be indicative of infections that are relatively close to the uterus, so give them a call. Get that treated. Number 5 is dizziness. This can sometimes be caused by blood sugar issues or blood pressure issues, and blood pressure issues can point towards preeclampsia. And we really don't want pregnant mamas falling down. So please, if you experience dizziness, call right away. Number 6 is a persistent headache. Again, headaches are never fun, and pain relief options in pregnancy are really tricky, but because of persistent headache, one possible cause could be elevated blood pressure. We really want your care provider to know so they can rule out anything more concerning. Number 7 is sudden swelling, especially of the hands and face. Your ankles are going to swell. That's pretty normal. Blood volume's increasing by 50% and gravity brings us down to the ankles. Yay, elephant legs, peachy, so sexy. But if that swelling comes on suddenly and is especially up here, that can be another sign of preeclampsia, so call your care provider. Number 8 is blurred vision. This too is another indicator of preeclampsia. You may have noticed that your care provider asks you almost every time you see them about blurred vision and all these things. That's because most prenatal visits are spent trying to identify preeclampsia before it becomes a really bad problem for mom and baby. That's their job. Number 9 is more than 4 contractions in an hour. Now, if you're full term, 38, 39, 40, 41, 42 weeks, yay! But if you're before that, not so yay. So pay attention if those contractions are coming more than 4 in an hour, call your care provider. It could be indicative of preterm labor and need to figure out how to manage that, either stop it or if it's safer for baby to come or not. Number 10 is a dull backache, and if you've watched What Does a Contraction Feel Like, then you will recognize that sometimes that backache is in fact the contraction. So if that's happening, especially with a on and off type pattern, call your care provider if it's not ideal for baby to be born quite yet. Number 11 is pelvic pressure. As baby is making their way into the world, they get lower and you feel that before they come out. So if that new pressure is happening, call your care provider. Number 12 is premature rupture of the membranes. No, not talking about the dance in high school with the fancy dresses and stuff. We don't do that part in labor. But if your waters break beforehand, then it will more than likely mean that labor is starting within a day. Your care provider needs to know right away. Pay attention to how much water, the color of it, and the smell of it, so that you can tell them that. They'll need to know. Number 13 is a decrease in baby's movement. If you're accustomed to baby having their party at a certain time of day and then it's awfully quiet, drink some juice. The nice influx of sugar tends to wake up a napping little one. And if you're still concerned, call your care provider. If all you find out is baby just happened to be sleeping and all is well, perfect. We like that news. Number 14 is vaginal bleeding. We're not talking the blood-tinged mucus. That's fine, that's expected. We look forward to that sign. But if you experience bleeding like a period, do not pass go. Call your care provider right away, quite frankly, while you are en route to the emergency room. That is not safe at any point in pregnancy or labor. And finally, number 15 is if you just have a bad gut feeling. You've heard me say that I trust babies. Well, I trust moms too. If something tells you that things aren't right, call your care provider, get that checked out, see what's going on. So many moms are afraid that they're going to bug their care provider and everything's fine and it was just a silly waste of energy and it's all good. If it's all good, isn't that the best case scenario? And setting your mind at ease has value as well. Listen to your gut. I hope you never have to deal with any of these. But if something does come up, call your care provider. Let them know what's going on so that you can come up with a good plan of attack to keep you and your baby healthy and safe. Even though this wasn't a fun topic, please do like this video and share it with your friends to keep everyone safe. And be sure to subscribe. I'll be posting new classes every week and I don't want you to miss out. Until next time, know your options and own your birth.